afford them is because the insurance companies constantly gouge us.
The difference between a tax and a payment on health insurance is I go to jail if I don't pay my taxes, so we can put that to bed now.
What will this do to the economy of Colorado?
We are offering universal health care, and this is where the big difference is that everybody is covered.
We are the 99%, and the healthcare industry is the 1%.
The current system leaves more than 350,000 of our fellow Coloradans with no health insurance at all. Now, to me, that's disgraceful. In a rich, compassionate state, we ought to provide health care for our neighbors when they need it. But it's also stupid, because then those people get very sick and they go to the emergency room, the most expensive place in the world to provide health care, and we all get to pay for it because they're not insured.
Well, ColoradoCare basically allows us to create our own Colorado-based state healthcare system. We would put all of our healthcare dollars into a nonprofit Colorado Healthcare Trust Fund managed by a board of trustees that we elect to represent our interests.
But this will cover everybody, every Colorado resident. It eliminates all the insurance premiums you currently pay, it eliminates all the deductibles you currently pay, and eliminates most of the co-pays that you have to pay.
Here's how it's going to work. It's a payroll withholding tax, 3.3% for the worker and 6.7% for the employer. An individual who's self-employed will pay 10%, which is the standard for all payroll deduction taxes.
There is nothing in the amendment that talks about a trust fund. We've heard the trust fund thing before. They talk about the Social Security Trust Fund. There isn't one.
So the only way they're going to get the prices down and to be able to save this $5 billion is to pay doctors and hospitals less. This money's not going out of state. The money may be processed through health insurance companies that are located elsewhere, but the money's going to hospitals and laboratories and physicians.
It will set the prices, and you will have no recourse about what you pay or what people can collect. It's immune from the regular checks and balances of government. It's outside government. It does not provide you health care. The initiative, health insurance, the initiative specifically says that. So you can only get the health care that this body decides to give you. Its elections are also outside the regular parts of government because it's exempt from TABOR, and TABOR specifies when elections have to be held and how propositions have to be put to the public.
That over 300 people in Colorado die each year because they were not able to access the medical care that they need. And so I think that by creating a system where everyone pays in and simplifying the cost and administrative overhead, we can be sure that we are paying less for high-cost care, more for upfront quality preventive care, and save ourselves money overall, because in the end, we all pay for this with our premiums right now.
It's important to know that the Affordable Care Act was not offered as universal health care. It's offered as affordable care, and it was meant to bring prices down. We are offering universal health care, and this is where the big difference is that everybody is covered, and we know.
Coloradans face a stark choice this November, and we only get two choices. We can pick ColoradoCare, a plan that will cover everybody and save billions, or you can vote no, which means you're voting for the status quo, which is Obamacare and our health care directed by out-of-state insurance companies. And you got, whatever you say about ColoradoCare, you got to like the fact that we have the Independence Institute asking you to vote for Obamacare in November. That's a change.
It was people like me that warned that these kinds of things would happen to Obamacare, and people like Grace Marie who warned what would happen. The things we talked about have come true. Now we're going to warn you about what's in this initiative. You have no idea what the system of ColoradoCare is going to look like, but it's a very good bet it's going to look like Medicaid or the VA. You will have no control over how much the board is paid, and when we saw the Connect for Colorado, the health exchange, we saw that its administrative costs did not go down. The salaries paid to the people in it were huge, and you couldn't get an audit out of it to save your life. People say the administrative costs will go away with the insurance companies. The problem is the insurance companies are actually pretty efficient at doing what they do, and if you really want to see bad administration, try Medicaid.
They promise that it's going to only cost a certain amount. It always costs more. They said with Medicare, when it was passed, it would only cost, what, $9 billion by 2020. by 1990, it cost 4 or 5 times that, and it's only gone up since then. So the promises of what they say, they don't know that, and the only way they're going to be able to get additional revenues is either higher taxes or further cutting payment rates to providers.
These are heavy taxes. Colorado taxes, about 30% are paid by 3% of the population. Do you really expect them to stick around for this?